Hello people, welcome to my channel Physio Guide by Divya. Today I am going to teach about physiotherapy treatment in stroke patients. Firstly, we'll see how to improve sensory function, how to improve motor function, strategies for tone reduction, if there is any tone impairment, how to correct that, strategies to improve strength and balance strategies, what are the how to control and how to improve these muscles. Okay, these we are going to see in the physiotherapy treatment. As soon as the patient is medically stable, if the patient is medically stable, we can go for physiotherapy treatment. So first point, the greater the patient is encouraged to use the affected side, the more the chances of increasing the awareness and function of that area. So sensory stimulus plays an important role for recovery. Next, sensory stimulus stimulates tactile, touch, mechanic and muscle receptors. Example, what are the example means like stroking, stretch, and superficial and deep pressure or approximate can be used. Okay, example, stroking, stretch, superficial and deep pressure. Next one, stroking the hand with different textured fabrics, pressing objects on the hands like coin, button, key. With that we can press and ask them to identify those objects. Next, shapes also we can draw like a phi in the hand and ask them to identify letters, numbers on the skin. Okay, stimulus should be sufficient intensity to engage the system and for good results. Okay, next, attention need to be maintained and should be focused directly on the stimulus and task like visual, tactile and proprioceptive stimulus on the more affected side like stroking, icing, ice with the help of icing, and brushing and vibration on the limb. Okay, next, we should teach active visual scanning movements. We need to improve eyesight, active visual scanning movements through turning head and axial trunk rotation towards the more involved side. Next, cueing like visual, verbal. Visual means eyesight, verbal means speech, and motor movement is used to direct the patient attention. Like for example, a red ribbon is taped on the floor and the patient directed to visually follow the line from one side to other. Okay, we need to check the visual scanning exercise and trunk rotation. Functional activities that encourage bilateral interaction should be encouraged. Like for example, functional activities like example, pouring a drink and with one hand and drinking from a cup with other hand. Okay, both interaction need to be identified. Next one, to improve motor function, muscle function. Firstly, ROM exercises, ODMA need to be maintained. Self ROM techniques. What are the ROMs exercises? Means how to improve motor function. Means ROM, range of motion exercise, are initiated early to maintain joint integrity and mobility and prevent contractures also. These three, to prevent these three, we need to do range of motion, means active movements need to be encouraged. Active movements, and if the patient cannot do, we need to assist. We need to do passive ROMs with terminal stretch. Okay, should be performed in all motions. Now, odema means swelling may be developed with loss of the voluntary movements. Due to no movement, swelling may develop. So this can be maintained by doing elevation, lifting the leg or hand, and massage by doing massage, or icing, rapid icing, or compression or wrapping. That bands will be compression bands are to be advised for odema patients. Okay, next is self ROM techniques. Motor self ROMs means we must ask the patient to do the exercise by their self only. Self means by doing ourselves. So this is, if this is an affected limb, this is unaffected. Nice. Affected extremity is supported and lifted with the help of the unaffected extremity. Tabletop polishing to the unaffected limb, forward, backward and side to side. Sitting, hand clasped together and reaching the floor. Okay, supine, both hands clasped together together and placed behind the head and the elbow flat to the mat. Okay, these are the self ROMs need to be done by ourselves. Now strategies for tone reduction. If there is any spasticity, tightness, to release that tightness, so tone reduction, spasticity. Strong spasticity is seen during the middle age of the recovery in stroke patients. This spasticity is inhibited, means is decreased by prolonged pressure and weight bearing exercises. Techniques, what are the techniques to reduce tone? Means include elongation of the spastic muscle through ROMs and positioning. Okay, these are to reduction to tone. These are the methods need to be followed. Now local facilitation means like muscle trapping and vibration can be applied through active antagonist and prove successful in further reducing spasticity. Next, modalities and splinting can be effective in reducing tone. Next one, inflatable splints like air splint stabilize and maintain an extremity in elongation position and provide tone inhibition. Next, strategies to improve strength. So muscle weakness is a major impairment for stroke patients. Exercise modalities for strengthening exercises. Strengthening includes free weights, elastic bands need to be with the help of bands, and machines. Like with the help of those machines we can improve the strength. Patients with less muscle power like 3/5 with less than 3/5 means gravity eliminated exercises with power bands, sling, suspension or aquatic means water exercises are indicated. Patients with 3/5 means muscle power 3/5 gravity resisted active movements are initiated. Now patients with adequate strength are progressed to exercises using added resistance. Okay, weights are added, so added resistance is maintained. Next, for example, in this adequate strength we can ask them for stair climbing while patient is weight bearing and weighted ankle cuffs. Okay, and with the help of the cuffs in the leg we can say the patient for stair climbing. Next, balance strategies. Balance strategies means once the postural means straight alignment and stability is achieved. Next, upright posture and patient is ready for COM, coordination of movements control training. Okay, balance training, they are ready for it. Okay, in standing and sitting the patient is instructed to explore her limit of stability through low frequent weight shifting. Firstly, we need to ask them for low weight shifting. Next, this goes to high shifting, vigorous. Next one, the patient learns how far in one direction she is moving safely and how to align coordination of movement within base of support to maintain upright posture. So I have given everything in the notes. Once check it out notes and you will understand this topic clearly. Okay, this sensory, how to improve sensory, motor, tone, and how to maintain tone and improve strength, balance strategy, everything I have given in the notes. Once check it out. Thank you for watching this video.